We're supposed to be in the middle of unlocking our economy. But as coronavirus cases keep surging, we're over 8 lakh now on an all India basis. Are we going to see more and more of mini lockdowns? Well, that's what the case seems to be. In the last few days, we have seen lockdowns being announced in Pune, Pimpri-Chinchwad, in Maharashtra, in Bengaluru, in parts of Uttar Pradesh, in Jammu and Kashmir, in Thiruvananthapuram, just to name a few places. In fact, some parts of Greater Mumbai, Kalyan and Dombivli have also gone into an extended lockdown. Now, the question is, how does a local authority decide when to go into an extended lockdown or, a lockdown for a week or so? What is the criteria and what does it really achieve? So I had a chance to sit down and speak to experts on the subject, and Dr. Shashank Joshi, who's a top doctor with Leelavati Hospital in Mumbai, also a part of the Maharashtra government special task force on coronavirus, explained to us that it depends on case fatality rate, doubling time, absolute number of cases. These are the key parameters, but perhaps the most important parameter why a local administration or a state government decides to impose a lockdown for about 10 days or a week is the fatality numbers. If they go above 5% or so, that is an unbearable situation for any local administration, and that's when they feel it makes sense to put in place some curbs. Now, what would curbs like this actually achieve? Well, the first thing they hope it will achieve is cutting down transmission on the disease and keep people in place so that they cannot transmit from one place to the other. Now, this is very interesting because the official stance of India is that we are not seeing community transmission so far. Of course, all protocols have been put in place. There are very strict guidelines for opening up businesses, establishments, offices, etc. But despite this, if it seems like it's not working, sometimes the only way really is to impose a lockdown to break the chain and cut down transmission. Another important parameter perhaps that a lot of local administrations look at is whether the number of cases coming in are overwhelming available hospital beds or medical facilities, and that is also an important one where you will need to slam the brakes down and hope you buy yourself some time. Now, this is not just the case in India. Even Hong Kong, Singapore, a lot of places around the world have opened up and then locked down again for some time and then opened up again. We can refer to these perhaps as mini lockdowns, and we're likely to see more and more of these before we find a vaccine and as we get into what could be our peak period. The Times Fact data says that the peak is yet to come and may hit only in September. So what impact does this have? The worst impact, as you can imagine, is on businesses. Businesses which first open up hoping that they can get everything in together, they can get their staff together, get the wheels moving and get revenues on track with all the SOPs and the guidelines, now have to figure out how they can close down again. So the on-off is most detrimental to businesses. In fact, R. Sriram, resident editor of the Economic Times, who I spoke with, said these mini lockdowns is going to impact profitability in the second quarter deeply if they continue again and again. The sad part is that they're most likely to take place in our crowded areas, which are our big cities, which is also the center of most commerce. So we're in for a situation of these on-off lockdowns for some time, at least in the foreseeable future.